This is Dr. Helen Pensanti, and welcome to Doctor to Doctor. You're going to learn something today, so stay tuned. Hello, I'm Dr. Helen Pensanti, and welcome to Doctor. With me today is Dr. Bryn Henderson. Thank you so much for coming. I really appreciate it. What I would like to do is give a little backstory to how I met Dr. Henderson. Dr. Henderson actually hired me to come and do some women's health issues. Many of you know me as a natural hormone specialist. And when you get hired in a new office, there's something called shadowing the doctor. So what happens is you walk around the doctor as he goes from room to room, and you watch him practice medicine, and he's expecting you to watch how he deals with his patients, because he wants you to treat his patients as compassionate and intelligent as he does. And so I started walking around and shadowing, and as I watched him practice, my mouth dropped open. I was in shock because I had never seen anyone practice medicine the way Dr. Henderson practiced. And I was taken aback, and I asked one of my friends asked me, they said, "What are you doing over there with Dr. Henderson?" I said, "Well, the only way I could explain it is, remember when we went from stamps in mailing and putting it in a mailbox, and then we went to email, and the feeling of what just happened to us?" That's what Dr. Henderson is doing with medicine. What just happened to us? He's doing a type of medicine that I have never seen in my 35 years of practicing medicine. Just to give you an example, I don't think you've even written a prescription for pain medicine since I've been there.
That's true.
You help people let their own bodies heal themselves.
Absolutely.
So today, what I want to start with is joint pain, because we see a lot of that in the office, and I just want to start from the neck and go to the shoulders, the elbows, the hands, the hips, the knees, the ankles. And I want to talk about joint pain. So, take it away, doctor.
Most joint pain is predicated on injury, and most of the injury is predicated on use. And that means that we have to use joints, and that's a good thing, except when we don't stretch them or we don't have the right dynamic or the right balance in them. Probably the greatest deficit in terms of balance in our body is in the joints of the knees and the hips. But when you get into the neck, if she'd like to start at the top, Dr. Pensanti wants to start at the top and sort of work to the bottom, we can do that pretty easily, because most of the injuries in the neck have to do with unexpected, like a car that gets rear-ended and somebody goes in front and then goes in back, and that's very typical of what would be called a whiplash. Well, that's pretty safe and benign unless you're 90 years old and your neck's pretty stiff, or you're real young and it hasn't moved, or you're really taut because you're bracing for the accident. Then you have injuries that are also on the supportive structures of the joint. So the joint itself has inflammation, and it has these, I guess we'd call it degenerative changes as we age. So what we should do is we should look at how to support that and limit the degree of overuse of any joint. And it's done principally by supporting the joint with strong muscles, aligned ligaments, and healthy tendons. So what I'd suggest when you look at joint pain, especially in the neck, you'd make sure it's lined up, and you'd make sure it doesn't hurt as you put it through a range of motion. So there's 4 basic range of motions for the neck. You can flex it, and that means your chin to your chest. You can extend it, that means your chin to the ceiling. You can side bend it, that means your ear goes to your shoulder. Or you can rotate it, which means your chin goes to your shoulder. So there's 4 basic movements of the neck. And each day, many people get up and put their neck through a range of motion, just swinging it around, and that's a good idea. But most of the injuries occur because they do not have full range of motion, and they get some unexpected, I'd say, trauma to that area. Does that make sense?
It sure does. Now, what I have seen in our office, your office that I have now come into, is a lot of people postpone coming to see you with neck pain because they can take Tylenol, they can take ibuprofen, they can take medicine. Pain goes away for the day or a couple of hours, and they've learned to live with it. Now, I'd like you to address why not seeking a physician when you have neck pain is not a good idea.
Good question. Most neck pain, like I suggest, is rooted in inflammation, but it causes a series of consequences in our bodies that make it so things like Tylenol do work, but it's temporizing because it doesn't get to the cause. Tylenol is a very good analgesic. It stops pain. Anti-inflammatories, ibuprofen, Advil, Aleve, help stem the inflammatory response. Then you can get into wild medications that are a little overboard for some. That would be narcotics and things like that are probably 3rd-line medications. But most of those are not necessary if early on you make sure that you take something at the first sign of injury. So my mother used to say it's better, a little early is better than a lot late. and I would say that if you combine a pain reliever, something simple acetaminophen with some simple ibuprofen, then you would have analgesic on one side and anti-inflammatory on the other, and that's commonly used, and it's not prescription. So you can take 2 of each on a full stomach, because the side effects are tummy problems, and you'd have pretty good relief real early.
Well, let's say that medicine failed.
Oh, yeah.
And a lot of the patients in my previous medical experience, not with you, the doctors would just say, here's Norco, here's Tramadol, here's, whatever hardcore drug. Then the patient would be addicted. And I had patients where I was at one clinic I was at, I had 100 patients. They weren't my patients because I was a traveling physician, so I was filling in for a physician. I had seriously 100 patients on Tramadol that came in every month for their fix. And I was sweating because I was thinking, oh, I don't think this is a good idea. But, the powers that be would come in and say, these aren't your patients. This is Dr. So-and-so's patients. He's coming back. You're just filling in. That's wrong.
Well, our approach is different in 2 ways. Number one is it's wise to figure out the cause. In other words, in lieu of dispensing, why don't we take the time to see what the cause could be? Because there's many chronic illnesses that could be causing that pain as well.
All right, let's hear what they are, so our audience knows what these chronic illnesses are that's giving them neck pain that isn't whiplash. It isn't that they slept wrong on their neck.
Well, the sleeping wrong on their neck may have aggravated a pre-existing condition. The most common of those are arthritis. And there's many types of arthritis, 4 major types of arthritis that we see very commonly. Osteoarthritis is the most common. And as we age, we have the degeneration of these joints, and that's the foundation of osteoarthritis. Then there's the arthritis you get from rheumatoid. Rheumatoid is symmetrical, so if it happens on this hand, it happens on that one, and it's additive, so if there's 2 fingers on each hand, pretty soon there'll be 3 and then 4, and it's deforming. So your hands, instead of being symmetrical and straight, would be symmetrical and deformed. So it'd be tough to even open a doorknob. That's rheumatoid, and rheumatoid happens on your toes as well as your digits of the hand. So that's just 2 very common. More types that are common, I would say, is gout. Gout begins mostly in the foot, big toe of the foot, can go to the knee real easy. But once you get systemic gout, it can manifest itself in any joint. These are little joints, so they're not as common as the big ones. And of course, gout is renowned because it does such damage on your kidneys. If you took a crystal of gout and put it on your hand and just slip that across the palm of your hand, it would bleed. Those crystals are so sharp, they cut right into the bone. Another very common type of arthritis that is missed often is cyridic. Psoriasis causes, besides the rashes on your elbows and knees, psoriasis causes a severe arthritis. And you can use many types of medication for it. Sometimes it requires injections to get ahead of it, because what happens is they walk and use those joints far longer than they should and erode some of the joint tissues and impair the ability of that joint to move normally. So the lubricant is necessary to get some lube in there to help it move better.
All right, let's move on to the shoulders. We see a lot of people that have rotator cuff problems. Yesterday you did someone who had, they were older gentleman, and he was thinning out his, what was the word for it?
Labrum.
Labrum. And we took him into the ultrasound room, and we were able to immediately see that he had tears. And let's talk about the shoulders. A lot of people have torn their shoulders to pieces, especially the...
Shoulder is the most complex joint, or one of the most, if not, I think it's the most complex in the body. It has a huge range of motion. Just think of all the different ways that shoulder moves. And in each case, as we age, we oftentimes don't exercise that joint. In fact, many of us, as we age, we slow down instead of continue our normal activities. And that causes the inflammation there to move into what they call a frozen shoulder. A rotator cuff is about muscles. A frozen shoulder is about that joint becoming so inflamed that it hurts to move. And then you don't do the stretches you're to do. And there's a lot of wisdom in making sure, make sure every morning everything works. I don't care if I'm strong, but I do want function. So I make sure everything works. Sometimes before I even get out of bed, I'm moving my feet and I'm flopping my arms. Why? Because I want to make sure everything works.
All right, let's talk about elbows.
Wow. Okay.
People have tennis elbow, and they're not playing tennis.
Well, tennis elbow and golfer's elbow, and those are caused because there's no correct manner that they're not stretching correctly. So these muscles all attach to a bone through a tendon. So a tendon attaches a muscle to a bone. A ligament attaches a bone to a bone. So a golfer or tennis elbow is when this bone that sticks out here it's an epicondyle, it's called, but that's not real germane. This bone has muscles attaching to it by a tendon. And when you don't warm up correctly and you're doing an overhand or on backhand, anything on that tennis, you can rip those little teeny tendons right off that muscle. And golfers, of course, are doing, consider the rate of of power in that swing. I mean, it's just outrageous. The speed of that ball and the angles that happen, you can rip those tendons off those bones pretty easy with either golf or tennis. Probably you could include jai-alai and some of the other fast-moving sports as well. I've seen it in ping pong a lot, or table tennis, because they're using wrist as they move down that elbow. But that elbow, remember, has supination, where the hand comes up, and pronation, where the hand goes down. Those tendons are in the middle of the arm. They're helping support both bones as they come from the elbow into the hand. So that's the elbow.
All right, let's talk about wrist. We've got everybody's on computers, and they're constantly having pain in their wrists, and they come, do I have carpal tunnel? I don't want to have surgery. Help me, doctor.
Well, that's common. Carpal tunnel syndrome is because the retinaculum, there's a portion of a ligament that goes across our wrist that gets inflamed too. And then the nerves are in a bundle with the blood vessels, and they come down the front side, what we call the palm of the hand, and they sneak in here and they get inflamed, and it pushes on those nerves. And then you have problems with these fingers in the middle, the three in the middle, and therefore it's called a median nerve. And that median nerve that gets inflamed is the cause of carpal tunnel syndrome. These bones are the carpal bones. That's why it's called carpal tunnel syndrome. Okay? All right. So now, then you end up having surgery sometimes on that, or you could have injections that calm down the inflammation. Either work well, but surgery we use as a last resort, not a first resort. You can also get creams. On the internet, you can buy carpal tunnel cream. That's an anti-inflammatory, but you're still going to have to build the muscles that support the wrist to mitigate the recurrence of that problem.
All right, let's go to the hips. We got a lot of people having hip transplant, or not transplants, what do they call it? Hip replacement. And some fail, and they have to have it again. And
well, when you get into hip replacements, you're also getting into larger joints, big joints, one of the biggest in the body, in fact. And so what impacts that is the strength of those bones. So often osteoporotic, that means the thinning of that bone, will make it so it's very hard to get a good repair without replacing the whole joint. If you replace the whole joint, it's sometimes easier and more successful. It just sometimes doesn't last as long.
right.
So how's that going to be? 5 years, 10 years, 15? As things move on, they last longer. And now they can replace, I've seen bilateral femurs replaced all the way down to the knee, and people walk within 2 hours after that surgery. 2 hours.
Yeah.
So it's amazing, and I'm now expert on all the new titanium and other materials used in those hips, but you should check them out. But again, if you realize those muscles that support that hip are what you should be working as we age. As you go from middle age into seniors, you should be working those hips.
And what do you suggest to do to work the hips?
I suggest
Walk?
Exercise. Walking helps you go front and back, but how about when you want to get that knee to your chest? Or how about if you're going to twist? If you're a golfer, walking, you better do a little bit more.
Got it. Okay, and now the famous knees. Everybody has a knee problem. It's always the ALC. Why?
The ACL.
Oh, sorry.
Yeah, the ACL is what the anterior cruciate ligament. And the biggest issue with a knee is that we've got to watch our weight. Look at me. I could stand to lose some pounds. I think that's true as we age and our metabolism slows down, our weight gets more, and it creates more of an impact on that knee. And then we are not doing the toe raises and the knee swings and things we should do to keep the lubrication in that joint. And therefore, that knee is susceptible to injury. Very common part of that knee is when you go too deep. These deep squats, you go down. In fact, you can see some cultures where they can sit on their heels, and that means that that knee is extremely taut. And those are tough if you're not mobile, very mobile. So I think the knees are usually damaged in sport. I mean, we hear of the ACLs being tore and other things, but it's pretty important to figure out what's damaged. Often patients come into our office and their pain isn't in their joint at all. It's in the muscles above the joint, or it is in the bursa above the patella, which is the kneecap. So above the kneecap is a series of muscles. They call them the quadricep muscles. Those four muscles form one tendon. That is the largest tendon in the body. It sneaks across the top of the knee and it adheres, it inserts into the tibia bone in the leg. That particular dynamic has to be lined up right. If you screw that up, you get what they call bow-legged or pigeon-toed. You're going to screw up the alignment of the knee. And that in and of itself is going to cause strain on the tendon and the insertions of the ligaments. The ligaments, again, are bone to bone. So when you're talking about the capsule of the knee, you've got ligaments on each side keeping it lined up. So if it is out of alignment, then you can cause damage to the lubricant leaking out of it. In fact, pretty common is damage to the knee that causes the fluid, the synovial fluid, to leak out to the back of the knee. And you'll go in and you'll get an ultrasound in the office. They'll say, oh, that's a Baker cyst named after Dr. Baker. But the long and short of it is it's a pocket of the fluid from the knee that's supposed to be in the knee, but it's not lubricating anything in the knee. So therein lies the need to make sure we have the correct diagnosis before we start treating anything. Because these knee replacements have taken on a life of their own. But it's common to see people that have multiples because they don't take care of the knee after the injury. In fact, I think as a rule of thumb, you could say this: if I've damaged any joint, knees, elbows, shoulders, ankles, it's a very good idea to have a support, a brace, something on that knee or joint anyway, for the rest of your life. Why re-injure it? Re-injure is going to be making a real challenge on that scar to keep that alignment correct.
All right, so we've got about 5 minutes left in this show, and I now want to, you've now educated our audience. I want you to tell what you do that's different from what I've seen for the last 35 years in medicine. When people come into your office, it's a different show.
Well, we do not rely on just the history and physical exam. The history is the most important part of the visit. We need to learn what you've done to cause whatever problem that is. And after that history, there's a physical exam that we supplement with an ultrasound. And that ultrasound gives us the ability to put the joint, whatever joint it is, through a range of motion and watch all the supportive structures as the patient is able to identify what hurts and why it hurts. If I move it this way, it hurts. If I move my neck down, it hurts. Wherever it is, then we can go right to that area and see if, in fact, there's fluid buildup there or there's strain on the joint at that point. So this is, instead of an MRI and a CAT scan, they're very good. In fact, we need them. But they're static. They don't allow you to move the joint and miss oftentimes an impingement. In other words, part of the supportive structures get stuck in the joint, and it doesn't allow you to see the full range of motion either. So what we do is first we identify what it is, and then we fashion a remedy for that patient. The care in our office is individualized. So if you had gout, it'd be way different than if you had just osteoarthritis. Both are bad, but they're completely different treatments.
I'm just reminded of a patient that had gone to numerous doctors before she showed up in our office and had the, what was it, the sacrum was broken. And she had an MRI, she had a CAT scan, she had the $1 million workup. They missed it.
Okay.
Talk about that one. That was shocking.
That's fair. She had a vertical fracture in her sacrum. So her tailbone, she had an additional crack in her butt. That's it. She had an additional line that went down that sacrum. How did we find that? Is because we did the ultrasound and had her move. She went up and back, okay? And so all of a sudden when she moved her knee out, it gapped, GAP, gapped that fracture. And that was very easy to see. And then we were able to put in the medication that closed the fracture. Good.
Well, we have certainly learned a lot today. I'd like to let you know that doctor's office is in Orange County, California, and it's right near the famous Orange Circle in Orange, California, about a block away. And if anybody is needing or has gone to other doctors and they just gave you a drug and said, go live with it, I want you to know that what I've noticed in the 2 months that I've been working there is that doctor takes patients that other doctors give up on. They've given up on you. They said, just take your Norco, take your Tramadol, take your drugs, live with it. He doesn't. He's a fix-it guy. He'll fix you. So if you've heard any of the things that he has spoken about today, and that's you, and you say, I don't want my doctor to give up on me. I want to live a good life, a mobile life, without pain, without drugs. Let my own body heal itself. That's what doctor does. So we've got 1 minute. Go ahead and say goodbye to your new patients.
Well, thank you for having us, having me. And I'd implore you to look at all the alternatives. Your body's a wonderful machine, and it has an innate ability to heal itself. You just have to optimize the body's functions and ability to do that.
Doctor's address and phone number is available on the bottom of the screen. Please feel free to call. He's welcoming new patients all the time. He doesn't turn anybody away. We hope we can help you. We want to help you. It's our desire to help you. Doctor is very compassionate. I've watched him with patients. He's not a cold, frozen doctor. You know, he is a compassionate man. And I urge you to go ahead and give that phone number a call and come on in and see us. We're here to help you.